Good evening, and welcome to Congresswoman Debbie Wasserman Schultz's Ask the Doctors. Congresswoman Wasserman Schultz and her guest will be happy to answer your questions. If you have any, if you're watching on Facebook or YouTube, you can put your questions in the comments section. Congresswoman Wasserman Schultz, the floor is yours.
Thank you so much, Mike, and good evening, everyone. I am Debbie Wasserman Schultz. I'm proud to represent Florida's 25th Congressional District, and thank you all for joining me this evening. As you and much of America know now, Broward County is facing a measles outbreak. As of today, Florida is reporting 10 cases of measles. The largest hotspot in our state is right here in Broward County, which is reporting 9 cases, 7 linked to my hometown of Weston at Manatee Bay Elementary School. 1 case has also been identified in Polk County, and Orlando Health has reported treating 4 patients in February, although this has not been corroborated by the Florida Department of Health. Measles is a highly contagious virus that can lead to severe complications and death, and we all need to have proper precautions, an arsenal of tools, and factual information to come out quickly on the other side of this illness. My thoughts are with the families and their children that have contracted the virus, and I desperately hope they don't fall very ill and have access to all the care that they need. But because this virus is currently circulating in our backyards, and because there has been a lot of news on the recent outbreak, it's vital that we all have correct information based on science and public health. During the height of the COVID pandemic, I frequently hosted an Ask the Doctors segment for the same purpose, to make sure people in my district and across the state are armed with the correct information they need to be safe and healthy, and to give you an opportunity to ask questions about the situation as it unfolds. We sometimes forget about how dangerous measles is, or we don't think twice about being exposed to it. That's because measles was declared eliminated as a public health issue in the United States in the year 2000. Thanks to a highly effective vaccination program that public health officials supported for decades. But surging vaccine hesitancy, which was turbocharged during the COVID pandemic, is fueling this resurgence, not just in measles, but other preventable diseases like chickenpox. Now we're dealing with a potential crisis in South Florida, and this refresher on measles will be very important as we move into the next weeks and months. We all have busy lives, and sometimes we find it difficult to consistently obtain accurate and understandable information. And for that reason, I'm joined tonight by an infectious disease expert, Dr. Eileen Marty. Dr. Marty is a distinguished professor at Florida International University, specializing in infectious diseases at the university's Herbert Wertheim College of Medicine. I'm very grateful that she's able to lend us her time this evening. Dr. Marty, can you briefly introduce yourself, please?
Well, you already did a beautiful job. I am a distinguished university professor at FIU, Herbert Wertheim College of Medicine, and I do infectious disease and outbreak response and a lot of immunology. And I'm very happy to help you with this very important issue because we really need to get this thing, put a lid on this outbreak.
Absolutely, and I appreciate your service so much. I think the whole country saw you so many times during the COVID-19 pandemic, really across the country on national television, giving sober, clear, science-based information that could help make people make the kinds of decisions that they need to make about how to keep themselves healthy and safe, answers to questions about vaccinations, and all kinds of things that you wouldn't think that we would need to have answers to, but at that time, with a pandemic that was brand new and that we had not experienced, getting information from public health experts like you was so important. Now, it feels a little unusual to be having an Ask the Doctors segment about measles, because one would hope that everyone is vaccinated against measles, and when we have a high enough level of immunity, I know that it's not something we have to worry about. But at the end of the day, nothing is more important than our health and that of our families and communities. And we have to all be in this together to ensure that the virus is rapidly contained. And this begins with a science-based rundown of the measles virus, what to expect, and how to stay safe. Now, before this discussion, we compiled many of the questions and concerns that we've been receiving from the people of South Florida, and these are some of the questions that I'll be asking Dr. Marty. And for those of you watching, if you have any questions, please comment in the chat box, and we'll do our best to respond to all inquiries. So let's dive in. First, I want to really ask you for a measles overview. As I mentioned, measles was declared eradicated as a public health issue in the United States in 2000. For that reason, many younger individuals and families may not have, probably don't have, firsthand experience with this virus. They may have gotten their vaccines as children, like I did, and never thought twice about what measles actually is. Can you give us a quick overview about the virus and the current situation in South Florida?
Yeah, I'll start talking about the virus in general, and then I'll talk about what's going on right now in South Florida. The first thing I want to say is this is a very old disease. Measles has been causing problems for humans for thousands of years. It's believed to have been introduced into humans when we got close to cattle. In fact, one of the worst diseases that killed thousands and thousands of cattle, rinderpest, is a close relative of measles. And so that's how it entered. And it turns out that measles is the most contagious virus known to infect humans. Of all the viruses, of all the bacteria, of all the fungi, everything, it is the most contagious, having a reproductive rate of between 15 to 20. And every time that it was introduced into a new area, for example, an island population with everyone being susceptible, it would kill between 15 to 30% of the people. It was one of the diseases that devastated Hawaii, for example. The king and queen of Hawaii died of measles. This is a disease that was absolutely devastating, and the whole picture of measles and all its possible complications only started to become a memory thanks to the safe and effective vaccines that we currently have against the measles virus.
Well, that's incredibly helpful and a really good history. Obviously, we had a king and queen of Hawaii many, many years ago and long before Hawaii was a state. But it's important that people know, and that's what I've heard as well, that it is the most contagious. So I want to focus on the contagion. It is, in fact, a very dangerous virus. It's why we've worked very hard to eliminate it through vaccination. Can you elaborate on the dangers posed by measles? You mentioned how contagious it is. I know recently, since we've had the explosion of cases here in South Florida, I heard, and your colleague, Dr. Mary Jo Trepka, mentioned this, that it can it can remain in the air in a room for 2 hours, that if you are in a room full of people, that 90% of the people will actually get it. So, I mean, those are things I've heard. If you can confirm that and why it's so easily spread in communities.
Okay, so remember that people who are fully vaccinated can get the virus in their body, but their chance of having any kind of symptoms is about 2%. An unvaccinated person who gets it into their body has a 90 to 95% chance of coming down with measles and the whole disease spectrum that measles constitutes. And I think that one of the key things people need to understand is that when measles initially starts causing symptoms, the early symptoms look like a cold. Red eyes, runny nose, sore throat, maybe a cough. You can have a really high fever, as high as 104, which can be very alarming. But generally, you're not clear that you have the measles in the first few days. As many as 4 days before you actually have the classic rash of measles. What you do find in people, if you know where to look inside their mouth, before they have the outside rash, is something called Koplik spots, which are these little white with a little blue dot type of lesions inside their mouth. And that's very typical of measles. And those are the benign things that measles cause. The rash that people get from measles means that the immune system has finally kicked in, because it's the adaptive immune system that causes the rash that people get from the measles virus. And so that also leads me to the next point that's very important, in that before you have symptoms, before you even have the fever, etc., you're shedding virus about 4 days ahead of the time. And therefore, that's really scary because you're shedding virus before you know you're sick. And you're going to continue to shed virus for at least 4 days after you have the rash. And therefore, there's that long period of time in which you're shedding a tremendous amount of virus. And this is a virus that gets into the epithelial cells of your respiratory tract, of your nose and your mouth, et cetera. And this sneaky little devil, it actually goes from inside one cell to directly inside the next cell. And therefore, it evades the immune system very effectively initially. And some of those cells turn on systems that kill the cells, the body trying to get rid of it. And so then you have all these cells chock full of virus that you then cough into the air. And that's why it lands as an aerosol that can then stay in a room for 2 hours easily. It is one of the diseases we really worried about whenever we do mass gatherings all over the world for the World Health Organization.
Wow. And what are the dangers posed by measles if someone does get it?
Right. So people who are unvaccinated and get the measles, those individuals have a 1 in 5 chance of having one of the severe complications that could land them in the hospital. And these complications have in part to do with another nasty thing this virus does, which is it goes to your bone, and it goes into the part of your bone where all your red cells and white cells are made, and it destroys them. And therefore, you don't have enough red cells, so you're anemic. You don't have enough white cells to defend yourself against all kinds of other infections, which means you're now susceptible to secondary infections. And so one of the more common bad complications that people get is a secondary pneumonia. So they start out with measles and they then have a bacterial pneumonia that we have to treat. Some very unfortunate people get a viral pneumonia from the measles virus itself, but that's a little less common. And that's only one aspect of the complications. There are 3 different neurologic problems that are directly associated with the measles virus. For example, people can get an immunologic response that's very bad to the virus that causes loss of the myelin, which is sort of the insulation of your nerves. And it's sort of like a multiple sclerosis type of picture. It's a demyelinating disease of the brain. People can get an unusual large cell encephalitis that can lead to other complications, including deafness, or it can directly attack your middle ear and give you long-term deafness. And also, if you are vitamin A deficiency, the combination of vitamin A deficiency and measles gives you high risk for developing damage to your cornea and possibly permanent blindness. So this is a very serious disease. It is. I cannot tell you how serious measles has been through the years. And by the way, when your immune system is lowered by the measles virus, it also affects existing immunity. So things that you were exposed to before and had developed immunity to, you've lost a lot of those cells. Not permanently, they come back in about 6 months, but you've lost them for about 6 months, which means that people are susceptible to these secondary infections for as long as 6 months.
Wow. So I'm well taken aback because that's a lot. But so, because obviously this is so dire and potentially serious, who's the most at risk of contracting measles? And if you've had measles, can you get it again? Okay,
so I'll answer the second one first because that one's easy. There are many different genotypes of, in other words, by DNA, different types of measles virus, or there were 24 different ones. But because of the measles vaccine, we're down to about 3 different ones in the world. But regardless of which type of measles virus, wild virus, all of them are completely eliminated, are completely well handled if you have immunity. So what's interesting about measles virus, which is a type of paramyxovirus, is that the binding site to its receptor is very, very key and cannot change. And so even if there are other variants, it doesn't have the problem of COVID. You retain immunity for life. But only if you either have had the measles or you have had 2 complete vaccines against the measles. And then
Okay.
that part's easy. Now, the other part of your question, which you also want to know about is, can you refresh me again on what that was?
Who's the most at risk?
Oh, who's the most at risk? Okay, so who's the most at risk is anyone who's not vaccinated. That's the person who's most at risk. And then beyond that, you have to consider the fact that we don't vaccinate people for measles until they are 12 months old, unless there's an emergency reason to give it to somebody between 6 months and 12 months, and I could explain that later. And then that second vaccine is about age 4 to 6. So anyone younger than 1 is at high risk. In addition, pregnant women are at high risk of complications from measles, much higher complications, because their immune system is already down. They don't need a virus that's going to make the immune system even worse. And then on top of that, anyone who is already immune deficient is also at higher, or taking immunodeficiency drugs that lower their immune response. Those people are also at higher risk. And the clinical presentation for people who have any kind of immunologic problem can be very different. They may never have the rash, because remember, the rash comes out when you have good adaptive response. So if you're not capable of mounting a good adaptive response because you have AIDS, for example, then you're not going to have a rash, but you're going to be infectious and you're going to have risk for all the other complications.
So, I'm thinking about this, and I know that there are, even my husband, I know other people, a lot of people take a medication that impacts their immune system, that lowers their immunity. If you have psoriasis or are taking a drug that suppresses your immune system. I assume if you've had the measles vaccine, even if your immune system is impacted, that you're still protected against measles, correct?
Yeah, and it's kind of interesting why. So many of the drugs that you're talking about, for example, somebody with psoriasis, those impact the T cells, right? And the main thing that you get from the vaccine is incredibly fantastic antibodies that attack the one serotype, because even though there's different genotypes, there's only one serotype, measles, and that's not going to change. You're still going to have those B cells, even though you may be doing something to alter your T cells in order to reduce an autoimmune disease. So it does depend on exactly which medication you're taking as to whether or not it would impact you. There are individuals with certain types of cancers that do take drugs that do affect their B cells. Now, those people I would give different advice to, because in those circumstances, they are much more susceptible.
Well, all of this is to say that there is some increased risk, and generally, even if you're taking other medication or if you have other kinds of illnesses, and so if we don't reach the 95% level of vaccination rate, then it's presumably not just unvaccinated people that are at risk, correct?
Right. It's anyone who is immunocompromised enough to have an increased risk. And of course, obviously, as I already said, someone who is fully vaccinated can shed some virus, even though they have no symptoms and never actually get sick. So if a child, for example, goes to school, they're fully vaccinated, but the other kids aren't, whatever, and they get some measles virus in them, and it goes home to a pregnant mother or an infant sibling, that could lead to a real problem. So it's really important that we have that 95% level so as to protect everyone in our community, including those who can't be vaccinated.
Right, and I want to jump to prevention and vaccines, and so presumably your answer to what's our best defense against the virus is vaccination. But can you talk about doses and ages, and like I said at the outset, most of us have not had to think about this, either once our children are grown like mine, or who had a vaccine when we were children. So can you kind of just go over that? What's the standard protocol for vaccination for measles? And then I have a question.
Yeah, let me just sort of give you a little bit of a history lesson on that as well, because the measles vaccine is a live virus, but it's one that has been passaged through other things like eggs, etc., so that it no longer binds to the same receptors, not all the same receptors, and can't produce the types of illness that the wild measles can produce, right? So that's an important thing to know. The next thing people need to know is there's information out there about problems in the 1960s with the vaccine, and that is correct, because in 1963 and in 1964 and 65, we were developing the measles vaccine, and it's not the same one that we give today. Today, it's been altered so much that it is an incredibly safe vaccine. Ever since the 1970s, the vaccines that we've been using for measles have proven themselves to be absolutely safe and do not lead to any complications. And especially not, of course, there's always going to be somebody that's allergic to the eggs or whatever it might have been grown in, but and that we have to take into consideration. That's why we want everybody else vaccinated, so we can also protect that person. But the vaccine we use today is extraordinarily safe. We give the same dose to everybody, and we start at age, like I said, at when you're 12 months of age. 12 to 15 months it can be given generally, because scheduling appointments and all that sort of thing. And then again, at about somewhere between age 4 and 6, we give the second dose. And we didn't know at first to give the second dose, to be honest with you. We learned that because there was an outbreak of measles in the late 1980s when we had been using a single dose, because the original vaccine makers thought that, well, if you're good for life from the real virus, you should be good for life from one dose of vaccine. But that's just not the way the immune system works, especially not an attenuated virus.
Okay, so that begs a whole lot of questions. Someone like me, I was born in 1966, so I probably only had one vaccine. If we're not sure how many vaccines we've had, and we obviously haven't had measles, and we can't find the information that we need about our vaccination status, I mean, I probably could dig up my records from my parents somewhere, but should we get a second vaccine, if we really only probably had one?
Or let me just give you a couple of things to know. We're in Florida, and traditionally, Florida for many years has been outstanding and compared to every other state in our efficiency at getting our young children vaccinated. And we have a program called Florida Shots, and that records your vaccinations. So you could actually ask this, if you live in the state of Florida, you can actually ask the state of Florida about your vaccine record, and you fill out a form, et cetera, and they will let you know whether you've had your 2 doses of vaccine or not. But yes, if you only got one vaccine, there's absolutely no problem getting another vaccine now. And there's actually been very careful studies done on this, showing that if you give a third vaccine to someone who is appropriately vaccinated, they have they may get a sore arm and a little bit of I don't feel good for 3 or 4 days, but that's about it. Nothing serious, and it just gives you added immunity and a few extra B cells to manage a wild virus.
And I know, we have a lot of transplants. I am a transplant. I've lived here since 1989 and really 1984. But my records were from New York. So I would have to contact another state to see if I had gotten the second vaccine. So really, if that's kind of way too difficult, getting another vaccination just in case, helpful, not harmful, and just makes it less likely that you could be exposed. Is that right?
Yeah, that's right. And in fact, we routinely at the travel medicine clinic give people a vaccine for measles if they, depending on when they were born, right? If we suspect that they probably only had one dose before.
Okay, that makes sense. In fact, given the travel I've done while I've been in Congress, it's likely that I already had that. So just to think about myself, I think I'm probably covered, but I wanted to make sure for folks who I represent that came from other states and who are adults that might be concerned about it. So just to go back to treatment, let's say you do come down with measles, or you have a child right now who's dealing with measles. What is, you covered the symptoms, but how is measles treated?
So there is no antiviral that has been demonstrated to be effective, which means that we have to give what we call supportive treatment. So you're going to give Tylenol for the fever. You're going to use moisturizers. You're going to make sure that the child has adequate vitamin A. A big problem, and I alluded to it before when I talked about blindness, is vitamin A deficiency. That vitamin A deficiency and measles absolutely do not mix. That is a recipe for catastrophe. So make sure that they have the foods that would give them adequate vitamin A, or supplements if necessary. And then really it does depend on the symptoms that the person has. Would you use over-the-counter types of treatments for the individual?
Okay. And
if they then develop a complication, then we're going to treat the complication. So if they get a secondary bacterial pneumonia, for example, we'll identify the bacterium, and we have, there's some that are more common than others, and we'll give the appropriate antibiotic for that.
And the next couple of things I want to ask you are pretty important and relevant to the outbreak that has occurred in South Florida. If you're not vaccinated and you were exposed, what are the correct precautions? Do we need to isolate and quarantine for any period of time? What's the scientific, straightforward advice?
So you're going to be contagious if you caught the measles and you're not vaccinated, and you're definitely going to be shedding virus before you even know that you have virus, as we talked about before. The recommended isolation period is 21 days. However, obviously, there are situations where if you can't be isolated, then you should wear an N95 mask if you can tolerate it when you're out and about, and be very hygienic. That's incredibly important as well. And you want to protect your family members from getting infected from you as well. And really, if you get the measles and your household is unvaccinated, they should run and get vaccinated immediately. We can give the vaccine post-exposure, but it's not as effective as having given it before you ever got exposed.
Okay, and another key question, because this is something that happens in routine vaccinations as when you're a child, where can you find the vaccine, either for your child or, if you want to get a vaccination as an adult, and how long does it take to become fully effective, and what level of protection does it give you?
Well, the level of protection, as I already said, is going to give you 90 to 95% prevention of getting any clinical disease whatsoever. 98% protection of getting any clinical disease whatsoever from the infection, because it's only a 2% chance of having mild symptoms. In terms of where you can get it, here in Florida, there are many clinics that offer it. Certainly your pediatrician will have it. In addition, you can get it from a Minute Clinic. You can get it from travel medicine clinics, and the Public Health Department of Florida also offers the measles vaccine.
Can you go to your local drugstore? Would they carry it there?
Sure, like CVS, Minute Clinics would have it, for example. I suspect that Walgreens would have it as well, and other Publix, etc.
Yeah. Good. Okay, and presumably it's covered by insurance normally, or you're not.
Yeah, you're not going out of pocket. It is covered by insurance.
Yeah, good. Okay, just wanted to make sure. So really, at this time, we should all be thinking about our families as well as our communities during outbreaks of infectious diseases, especially one as contagious as measles. I know, before this outbreak, I didn't realize just how infectious and just how intensely infectious the measles is. So just to give everybody an idea, I want to just close with a few more questions. What are the best practices during this outbreak that everyone in South Florida can be taking? I mean, both people who are vaccinated and unvaccinated.
Well, hygiene, paying attention to any of the initial symptoms in anyone in your household, including yourself. So again, the most common symptoms are conjunctivitis, the cold-like, runny nose, that sort of thing, cough, and a fever. Those are the most common symptoms that people present with. You could look in their mouth and see if they have Koplik spots. So be on the lookout for the symptoms. In addition, if you're going to be in a crowded place, you might want to, and you think that crowded place could have a measles infection, an N95 respirator will work very well because this is acquired through the respiratory tract by breathing it in, and that will reduce your risk, absolutely. And if you get infected, you really should try and isolate for the full 21 days if possible. Those are the best things that people in the community need to do. And then encourage everyone to get vaccinated. This is a safe and effective vaccine, and it's so much better to educate your immune system and be prepared against getting the wild virus than to get the wild virus.
That's the key thing here, is that this is a vaccine that has been proven safe and effective for 50, 60 years. And, it's just, I know that in our history books, in our history lessons, there were millions of people who died as a result of getting measles, people who ended up with serious health complications, that after the vaccine were completely avoided. So it's just so important that regular vaccinations, regular routine vaccinations keep you safe, keep other people safe. And it's just so critical. The other thing I wanted to ask you, if someone's planning to travel internationally, what's the best way to stay safe? Well, obviously to get a vaccination if you're unvaccinated. But there are lower rates of immunity against measles in lots of countries. And measles might have been eradicated here, but in some countries it's not. So if you're traveling internationally, do people need to check what the measles rate is there, and what should people do? Yeah,
anytime you're traveling internationally, it behooves you to go to the State Department website and learn about what is going on in the country that you're going to, because the State Department keeps a record of outbreaks and terrorists and other problems going on, and you can actually register with the Department of State, and they'll send you information before you travel to a foreign country about what's going on to make sure that you're ready. In fact, I do that with all my students when we do travel abroad. We register with the Department of State so they know what's going on, and we know what's going on, and we can keep each other safe. In addition, the same things that we talked about to protect yourself here from an outbreak are going to protect you there. The same hygiene, the same awareness, the same appropriate use of a mask when it's necessary, et cetera, are going to be very helpful. And of course, you've already said it, the vaccine, and you said it very correctly. Measles was considered eradicated as a public health issue in the Americas, not just the United States, by 2000, because we were so effective. And then people got misinformation in the late 1990s from Wakefield, who completely lied about a study he did and falsified data. And it just led to a lot of misinformation out there about these very, very safe vaccines. And that's part of the reason that people didn't vaccinate as well. And then during COVID, it was hard to get to the doctor. And so millions of vaccines around the world were missed, not because of vaccine hesitancy, but because it was just hard to get it done.
Yeah, exactly. And now people are playing catch up, and life happens. And so just let's underscore again, if your child, if you missed some vaccines for your kids, or you needed vaccines, during COVID, make sure you go back and take care of that, because prevention is the key to being able to make sure you remain healthy. And Dr. Marty, thank you so much for your incredible expertise and work and commitment to helping keep the public safe. My staff is telling me we don't have any questions that have been posted in the chat or in comments on Facebook, but we're going to leave this up on my Facebook page as well as on YouTube, so people can go back and watch it and get all this incredible information. I want to thank everybody so much for tuning in tonight, or listening to this recording of listening to this recording or tuning in tonight of our Ask the Doctor segment on measles. If you were unable to ask questions during this session, or if you need assistance navigating the outbreak or finding a vaccine, feel free to contact my office at 954-845-1179. Once again, thank you so much, Eileen, for joining me and for your continued work to keep Floridians informed and safe. And to our audience, please make sure you and your loved ones are safe, vaccinated, isolating as necessary. Please carefully review CDC, Centers for Disease Control guidance, because it's being updated often. The reason I wanted to make sure that I had a segment tonight of Ask the Doctors is because we have some misinformation that's spreading out there that isn't based in science, and I wanted to make sure that we could provide that information directly to you, and we'll leave it up so that we can make sure people can refer to it. We'll get through this once again, just like we did with COVID, if we all work together. Thank you all so much.
Thank you.